Thanks for staying with us this midday. October is National Breast Cancer Awareness Month, kicking things off today. And joining us to talk about ways to prevent and detect breast cancer, as well as an upcoming community event that you can attend, is Wendy Young. She's a nurse and breast cancer coordinator at St. Luke's Hospital in Cedar Rapids. Thanks for joining us today,
Wendy. Thanks for having me.
And, you know, breast cancer is right up there in terms of a cause of death for women. Can you fill us in on where that stands?
It's actually the second leading cause of, well, cancer is the second leading cause of death among women. And breast cancer is second as far as cancer deaths.
Okay, so it's a prominent cause.
It is very prominent,
death.
Yeah.
And, you know, a lot of women may be asking to themselves, okay, you know, how can I check myself for this deadly disease?
Right. We do encourage monthly self-breast exams. An annual clinical exam by their healthcare provider is also essential, and then that yearly mammogram is really key. So that's still the gold standard of early detection.
You know, we talk a lot as women about finding a lump during those self-exams, but there are other symptoms, too, to be aware of.
There's other symptoms. A lot of time women won't have any symptoms at all.
Really? That's scary.
Right. Right. A lot of cancers are found so early on mammogram that women didn't have any symptoms. But any change in your breast should be checked out by your healthcare provider, whether it's just a thickening feeling, just a different appearance. Even if you've had a normal mammogram in the past, if you notice any change, that should be checked out. Okay,
so for ladies who don't know, in case you haven't heard about it from all your friends already, what is a mammogram? What's the procedure, and what does that detect?
Mammograms will detect abnormalities, not necessarily cancers, but other abnormalities that there can be. It's a screening tool. It's a test. You're put in a compression, a couple different views, and it just gives us a great picture of what's going on inside the breast.
Okay, so you can detect a lot by having that screening done.
Yeah.
And what age is that typically recommended to start having
The guidelines are 40. Okay. You know, if you've got a family history or something like that, your healthcare provider may recommend starting earlier than that, but the general rule of thumb is at age 40.
Okay. Can you do anything to reduce any of your risk factors? As you mentioned, sometimes family history dictates you may
there are some risk factors you can't do anything about. The fact that you're a woman, the fact that you're aging, they may have some genetic history. Things you can do something about would be keeping your weight down, exercising, watching your alcohol intake, not smoking, those types of things.
Okay, and there's an upcoming event to talk more about breast cancer awareness. Tell us about that.
Living Well event. It's Breast Cancer Beyond Hope. It will be held at St. Luke's on the Nassif Heart Center. It will talk about prevention, early detection, and the very latest technology and revolutionary treatments.
Some great information, no doubt, coming at that event. Phone number to register, 369-7395, and it's free. Wendy, thanks so much for joining us today to help us kick off Breast Cancer Awareness Month. We appreciate it.